All right, looks like we've got everyone. Welcome. Happy, what day of the week is it today? Wednesday. Happy Wednesday afternoon, everyone. Hope you are all doing well, and thanks for joining us. We're excited to have you here for the first session of our Recruitment Boot Camp for spring 2023. And we're going to go ahead and dive in. So anyone who has joined us before for one of our webinars or trainings will be familiar with the Star Center team. But for anyone who's not, this is the team that is here to help you. We are all from the Star Center, and we are available to support anything that you need with workforce recruitment, retention. Feel free to reach out to any of us at any time. We're absolutely available and there to help you. And then for this Recruitment Boot Camp series, your host will be Helen Ray Vernier, who is unfortunately not here for this session or the next, but then she will switch off with me and she'll be here for the following sessions. And then I'm Alex Rowling, and I use he, they pronouns, and I'm a training specialist at ACU. And then also with us behind the scenes is Mariah Blake, making sure that everything runs here on Zoom and things don't come crumbling down, virtually speaking. And so if you have any issues with any of the Zoom features or anything, please feel free to message Mariah or to send her an email at mblake@clinicians.org, and she put that information in the chat for anyone. And then, like I said, we are here with ACU, the Association of Clinicians for the Underserved. ACU was started now over 26 years ago by alumni and participants in the National Health Service Corps, and they just wanted to continue to help serve the underserved and carry out the mission of the National Health Service Corps and to support all those in primary care settings. And as part of that work, back in 2014, they created the Star Center. And at the Star Center, we are one of HRSA's, the Health Resource and Services Administration, NTAPs, so National Training and Technical Assistance Partners. And like I said at the beginning, the Star Center staff are here to help you with all of your workforce recruitment and retention needs. Everything that we produce, our trainings, any of our reference materials are all free. We also are available to do one-on-one TA sessions, so we can provide training and technical assistance. So if you have some sort of issue that you want to talk through one-on-one with us, please reach out to us. We're available. We want to help you. And then with this Recruitment Boot Camp, so this session and all the other sessions will be recorded, and you'll be able to access them through the discussion board. And we'll talk about the discussion board at the end, but basically you'll receive a link for that. You create a login, and then you'll be able to post and talk to each other on there. So it's a tool for you all to communicate as a cohort. We will also post things like the coursework that we'll be doing throughout this series, as well as the recordings of the slideshow and PDF of the PowerPoint slides. So you'll have access to all of these materials as well at the end. And we'll also put links in the slides to a lot of resources, and we'll put them in the chat as we go through. And so many resources that we refer to that are on the Star Center website, we'll make sure that you have links to those so that you can go and easily find them. And then again, feel free to message myself or Mariah. Suzanne Spear is also on the call with us. And so any of us will be happy to help you out if you're having trouble accessing or finding a resource. All right, so the goals for this, for the RBC, basically this is a learning opportunity, but it's also an opportunity to connect and then to actually put what you learn into action. So as we go through, we will have these presentations, we'll have time for all of you to work with each other and support and inform your colleagues and share what you have learned or any tips, tricks, secrets you have. And then also to start building out your comprehensive workforce plan as we go along and really starting to put into action some of the things that we're going to talk about over the next couple months here. All right, so like I said, we do this through live webinar sessions and then assignments. So we'll try to provide some sort of coursework after each session. And then the idea is, hopefully you can complete it before the next session. And then that will help take you through the comprehensive workforce planning process, make it a little bit more digestible, and allow you to come to the next session with, say, any questions that you have or any insights or thoughts specific to what was covered before in preparation for the next session. And then obviously we provide technical assistance. Part of that is after the Recruitment Boot Camp wraps, about 3 to 6 months later, we're going to come back to you and we're going to make sure that everything's going well, try to help you out, right? Everyone knows that stuff goes completely according to plan, but just in case it doesn't, we'll check in and see if we can help you with anything down the road. All right, and then as part of the expectations, we do want everyone to consider presenting at some point, participating in the discussion. You're all here to learn from us, but also from each other, because you all are doing the things we're talking about in the real world and making it work. And so you'll all have insights that not everyone else will have. So sharing with your colleagues and building that network of support is really important. And after the sessions, you can always continue those conversations on the discussion boards. Okay, so some of the learning objectives to go over. We definitely want to assess kind of where you're at in your recruitment and retention process and the planning for that. And then we also want to learn how we're going to implement that through a comprehensive workforce plan at your health centers. So first, let's jump into a Menti and kind of get to know each other. Anyone that's been with us before is super familiar with Mentimeter and how that works. But for anyone that's not, you can go to menti.com and type in the code that you see on the screen, or you can just pull out, if you have a smartphone, pull it out and do the QR code function on it. So you just pull out the camera and you click on the QR code and it'll take you to Mentimeter. And then Suzanne has also put a direct link that you can click on in the chat. So we'll give everyone a moment to get to that. And then I will switch screens here and we will start on the Mentimeter. And if anyone has too much trouble getting on the Mentimeter, you can always put your response in the chat. Okay, so first question is, where is your favorite place in the world? Helen wrote this one. It's a big question. It's a big world. So we've got Paris, anywhere with your family. That's a good answer. Seville, Spain, Hawaii. Beach, just literally any beach. Could be up in Alaska at minus 30 degrees. That person's fine with that beach, just the same as a beach on Antigua. No difference to them. Bern, Switzerland. All right, cool. A beach, and this one has more specifications: clear water and white sand. South Africa. That's cool. Italy, Barcelona. Lots of Spain people. Beach and water. So basically beaches in Spain. So if we just did this learning collaborative in Spain on the beach, pretty much everyone would be happy, except the Italians. But you could speak Italian and we'd have to do lots of cross translation. That's okay. There's probably good Italian food in parts of Spain. All right, let's jump over to the next question here. Whoops, didn't mean to do that. Okay, so now if you want to share a little bit more about yourself, kind of specific to where you work, what your job is there, how long you've been in that role, or if I know some people move into similar roles, and so you might be like, well, I've only been in this role for 6 months, but I've been doing, similar work for 10 years. You can put whichever one you would like. I like how many people put any beach. There's like land and water, must meet. That's my only qualification for favorite place. It's great. Okay, so we have Parker from CCI Health Services in Silver Spring, Maryland. Staff writer, just over 1.5 years. We have a CEO for 12 days. All right, well, congratulations on the new position. Fantastic. We have Mariah from Communicare Health Center in Davis, California. She's been in her role 8 months. Christy, HR coordinator, 1.5 years. Let's see, Ashley at Compass Community Health and been there for about 5 months. Lena Alla, did I say that right? I hope so. Apologies if not. In Hawaii, and she's an HR specialist, been there for 6 months. Let's see, Angelica, senior recruiting and onboarding specialist in that role for 6 months. Amanda has been human resources director for about 2 years. And oh, real quick in the chat, we have Stu, who's been a CDO, Chief Development Officer at CCI for about 5 months. And we have April with us. I know April. Hi, April. And she is serving as the interim COO at CCI. And let's see, Marcy, 3.5 years. Let's see, Sina at Olay Health, HR coordinator in recruitment for about 1 year. Danielle has been at her health center for 9 months and has been at many other places as well, she says. And let's see, Neelam in HR for the past 7 years as a director of HR for 3. Fantastic. Shavonda at Coastal Family Health Center and 5 years in her director of HR position. Let's see, we have Kevin, senior recruitment manager for 3 weeks. Congratulations on the new role, Kevin. Medical recruitment management for 10 years. Fantastic. All right, Danielle, CHRO for about 9 months, and Sandra, 4.5 years, but in HR for 20+ years. All right, so we have a great, just broad cross-section of people from a bunch of different roles. A lot of leadership here, that's excellent. So you can go back and really get things happening. Oh, and let's see, someone came off mute. If you have a question.
I don't know where, like, the options are in this.
There we go, all right. Oops. Oh. Apologize, I accidentally, on my screen, jumped off the screen I was sharing. That's how good I am with Zoom today. Okay, so final one, what are you most interested in learning when it comes to recruitment processes? Oh, and real quick in the chat, we have Malulani, the HR director for 5 years. Oh, and let's see, someone else's mute is back off. There we go. Okay, best practices. Improved processes and tactics. Ooh, tactics, fancy. Sourcing Boolean searches. Okay, interesting. I'm going to write that one down. I have not actually had someone ask about Boolean searches before. That's something I haven't done properly since grad school. More best practices, improving processes, recruitment strategies, how to attract great talent with limited budgets, attracting high performers in a competitive market, provider retention, negotiations, making health centers presentable to potential providers. They're a rural health center with nothing attractive. We're going to find something attractive about being a rural health center. Best practices in sourcing, mission-minded people, improving retention. Great. Well, that is fantastic. We are going to cover lots of these things, right? Every health center context is unique, but as you can see, there's lots of overlap in the things that people are looking for. We're going to try to cover all of that over the next 5 sessions. Okay, so we are going to switch out of the Menti here and back to our slides. Excellent. So as we get started into this whole process, the kind of metaphor we like at the Star Center is that workforce is the fuel of your organization, right? If your organization's a car, fuel is what gets it where it needs to go, and having a full fuel tank is good. Maybe soon we might have to change this to like battery charge. We'll alter our metaphor, make it a little greener, but for right now, we're gonna stick with fuel. And so what do you need to have a full fuel tank of workforce? So these core components are really what we think of as kind of adding together to give you that full tank of workforce. And so a data-informed workforce plan, right? We want to have a plan, but we really want to make sure that we're planning appropriately. The way we do that is with data. We need information about the workforce in general, about our workplace in particular, and then we need to figure out how we're going to use that data to build out a plan to find gaps, to address those gaps, to continue doing the things that are working well, and to improve things that maybe aren't working as well. We need to look at our compensation structure, make sure that it's equitable and it's effective, right? Because even if you're, so like someone wanted to learn practices for recruiting, even if you can't pay someone top dollar, right? You may have a hard time competing directly with other organizations salary-wise. So we're going to talk about how compensation can be broadened beyond salary, how to make sure that that is evident in your job postings, and how to make sure that employees are able to take advantage of all the things you can offer beyond just payment. And you do need to have appropriate pay, but you can offer other things as well, and make sure that employees know about those before they come in, right, as attractors. And then we'll also talk about how to use those for retention, make sure that your employees are sticking around, right? We want to have a positive culture, right? Workplace culture is incredibly important. We want to engage with our employees and show them that they have a place to go and grow with us rather than moving on to other places. We're definitely going to look at recruitment and retention strategies, all different types of approaches to doing that, and how to lay out a really clear plan that helps you accomplish those things. Health professions training programs, right? Training programs are great opportunities for recruitment, and they can also aid with retention. We'll talk about that more later. Chief Workforce Officer, right? Having someone kind of in charge of this process. And there's ways to do things without a formalized CWO position. But then if you have the opportunity, it's also really good to have someone who their whole role is looking just at your workforce. It's sustaining the workforce you already have and at recruiting new people in it to deal with that natural attrition that comes from like retirement, say. High functioning managers, right? We've all heard the people don't leave bad jobs, they leave bad managers. Like absolutely a poorly functioning manager can cause a lot of turnover. We can make all of our managers much better and turn them into tools for retention, not resentment, which I like that phrase. I just came up with that earlier. I'm gonna start using that. I'm proud of that one. Policies that support diversity and cultural respect, right? That is something that can absolutely drive people away if they feel that they are not respected or they see their workplace not respecting others. So we'll talk about that kind of throughout, right? Because that kind of diversity and respect should be interwoven into everything we do. So we'll take opportunities throughout to really address that issue and those values. And then we take all of that and we turn it into a nice process, right? We need to have a vision, and then we need to assess where is that vision going? How is it going to get there? What are the gaps and challenges that we need to address and overcome? And then also, what are the opportunities that we have to kind of look around and figure out maybe some outside the box ways of doing things, or just stuff that maybe we've always done it because we always do it that way. And maybe it's time to kind of readdress things and make some changes. We're going to look at how that factors into retention, because we already have some staff and we got to keep them. We really want to keep those people that we've invested in, and they're a great opportunity to begin to grow our staff. And then obviously recruitment, because we need to add new staff. And then development. Once we get staff in there, we want to develop them so that people are filling in positions as they move through the organization rather than leaving to go find new positions. And we got to accomplish all of this, and so we need to build out an action plan to actually make it happen. Oh, and Suzanne put the link to the comprehensive workforce plan document in the chat. And then while we're talking about that, just to clear up some nomenclature real quick, you may have heard, you've certainly now heard of the Comprehensive Workforce Plan. That's what we're going to be talking about. There was also something that was for a while referred to as a strategic workforce plan. That nomenclature obviously got a little confusing. So at the Star Center, we have pushed for that to be rebranded as the Health Professions Education and Training HPET plan. So that HPET plan is just how you use training programs to increase your retention and recruitment opportunities, right? So that HPET plan is what someone's talking about if they say a strategic workforce plan. So we have HPET plan and we have comprehensive workforce plan. So if we look at that flow, that vision, assessment, retention strategy, recruitment strategy, development strategy, and action plan, where the HPET plan fits in with that is kind of under the development strategy, but it obviously feeds into recruitment and into retention as well. And again, we'll talk about that in more detail at a later session. Okay, so why is a comprehensive workforce plan important? Like, why do we need to write all this down? Because it seems like a lot of work. I'm not very good at writing. It's very slow. I type like a T-Rex. Takes forever. Why is writing all this down really important? Well, one, we need to track our successes, because I guarantee that every single one of you and your organizations are all doing something right. And you want to make sure that you keep doing the things that are working well, right? And you want to know if you're changing things to make them better. You want to know if they're working, how well they're working, and then that helps you plan, right? So like I like to run for exercise, and no one, like, don't get excited. I'm a very slow runner, but I still want to know if I'm getting a little bit faster over time, right? Or able to go a little longer. So like I can just kind of have a feel for it and be like, oh, I think I left at 5:30 and I got back at 6. So like took me that long to go around the neighborhood. Okay, that's pretty good. And then like another month later, I'll be like, oh, I think I got back at like 5:59. So I'm like a minute faster. And then like 8 months from then, I'm gonna have no idea what I was doing like 29 minutes running around the neighborhood, or was it 31? So like I kind of have some idea, but it's not real precise. But if I like write stuff down, if I use a stopwatch, all those little things, that obviously helps me track my successes or where I need to improve a lot better. This is just that for workforce, right? We're going to start looking at that data that we have. We're going to put it in context, and we're going to say, oh, this is going really well. We should keep doing this. Or, this is going okay, but I think there's a better way to do it. So let's start doing it that way and try to measure that change and see if it did improve things. Or we can be like, this is clearly not working. We need to try something else. And then you can look at those changes, right? And it helps with tracking those successes. It also helps you share that information, because you won't be in this role for forever, right? At some point, you will retire, or you'll get promoted, or you'll move to a different job, something like that, right? We all move around, and you need to be able to pass on that information. And so that continuity of knowledge is really important, and this plan really helps with that. The other thing it does is, as we're tracking all of that information and trying to innovate with this data, it allows us to identify opportunities for that innovation. And it lets us see these long-term trends, right? Because you might look at like, oh, 1 year our recruiting was really low, but the next year it was really high, so we're doing better. But when you zoom out, that's when you can see that larger overall trend. Is it overall increasing, or is it overall decreasing? How does that affect us? How does that affect the way that we're going to do things down the road? And we want to make sure it aligns with our goals, right? An innovation, a great innovation that has been really expanded by the pandemic is telehealth. But like expanding telehealth may produce some really good results, but if we do it at the expense of, say, a patient population that can't access that resource, that's not in alignment with our goals, right? But if we can do it in a way that just helps us serve more people, and we're still able to serve those people that can't access telehealth, well, great, like we're doing something new and it's staying in alignment with our goals. So we want to pay attention to that. And writing all of this down really, really helps with that. So Suzanne put the link in the chat already. When you go and download the Comprehensive Workforce Plan template, you're going to notice that it's a Word document, not a PDF. And it's a Word document because all of you come from different places that work a little bit differently and have slightly different needs. And we want this to be infinitely modifiable. you can add something in if you're like, well, we need this information in here and they left it out because that's unique to you. Great, add it in. If you see something you're like, we don't need this, you can take it out. And if you modify this and then you're like, oh, I shouldn't have done that, I can't undo it. It's okay. You can just go and re-download the original again and you'll have all that in there. But this really allows you to change and build out this document and expand it as you get more and more information over the years. There's charts and tables for you to fill in. You can keep expanding those, right? So that continuity of knowledge. First part is the instructions. And one of the really nice things that's been included in the instructions are examples. So you can go in if you're like, oh, I don't quite understand this table. Like, let me look at the examples in the instructions. Oh, they put FTEs as a decimal point. Cool, I can do that, right? So we have those little examples and that's really helpful. Then we also describe the rationale for each element in the instructions. So like, why are we putting this in there? Why is it important? Which can also be helpful, not just for your understanding, but if you have to sell this process, why you should be doing something to other leadership, right? Sometimes we need to talk to our colleagues and really help walk them through a process to show why it's important. And so this can be a good tool for that. And then we also provide some benchmark data, right? Some national averages based off of sometimes the UDS data, some of it's from the national numbers from our data profile dashboards at the STAR Center. So you have this data to kind of look at to get a quick comparison for yours. Then obviously you can go on to the data profile dashboards, which we'll talk about more in a different session. And you can look at kind of how your numbers compare nationally or even regionally and stuff and really fine tune that. But we provide some basic benchmark data in the tool itself. And then the real thing this is a template, right? So you're going to make your own plan out of this template. And like I said, the main body is in Microsoft Word, but then we also have a candidate tracking form for as you're going through this recruitment process. We break it down into really manageable steps, and that Excel tracking form can be really valuable, right? You may already have your own system for tracking candidates through the process. And so maybe you're just going to, modify that based on something you found useful in the form, or maybe you'll transfer it over to that form. Or maybe it'll just be like, no, I don't need that, but it's available to you. And I think it's a really helpful tool. All right, and then the action plan, the exciting part because it has action in it. But this is where we're going to keep track of gaps and also opportunities, right? And we're gonna try to figure out ways to, the Word document. So in the chat, we have someone asking where it is. There should be a link just 2 chats above yours, and that should take you right to it. And you'll just click on the link on that web page and it'll download the packet. So when you use this action plan, excellent. We're going to use this action plan to identify strategies for improvement and then also to help build a timeline, right? And anyone that's ever been involved with things that involve timelines, like, I don't know, construction, like remodeling a house or something, like stuff never goes exactly to the timeline. But having that created out ahead of time will really help with identifying when you do kind of miss a time frame and where you can make it up. And it helps you set kind of benchmarks and goals, right, that are realistic, that are based on, kind of a realistic timeline, and helps you communicate. Say you're recruiting, follow that timeline so that you're remembering to communicate with the candidates that you're talking to so that you don't lose someone because you kind of took a little too long getting back to them. Okay, so let's jump back into the Mentimeter. I'll give everyone a moment in case they need to pull it back up. Sorry, I forgot to give you the warning we'd be coming back to this. Okay, and now we'll jump back over to the Mentimeter here. So does your organization have a comprehensive workforce plan? Do you already have something in place? All right, we've got one response. No. Someone's not sure. Yeah. Okay. So we do have one yes. So someone's already on this. Okay. And then so far the majority knows, and then some unsures. And unsure is absolutely okay. I mean, that's one of the things, like we were talking about, that continuity of knowledge, right? I've jumped into jobs before where they were like, we're supposed to have stuff to give you to help out, but we don't know where it is. And like that happens. So having this, you know, it's on a really universal computer file. It's easy to pass on to the next person, right? And even if something happens to it, you can always go back and get the original and start building it out again. So this hopefully will really help with the continuity of knowledge stuff. And then you can always, you know, hopefully ask around for the folks that aren't sure. And I know a lot of people new in positions, like it's that flood of information that you're getting. And sometimes you have to revisit like, oh yeah, where was that thing that I was looking for that would really help with my job, right? I'm glad a couple people have one already. And then if anyone wants to put in the chat, has anyone used the folks that have one? Is it the Star Centers template, or did you create your own or get one somewhere else? Okay, and we'll move on. We have one more question. So if you answered yes, so the two folks, how frequently do you update it? And so that everyone gets to be included on this, how often do people think they could reasonably update it, or would they like to update one once they create one at the end of the recruitment boot camp? All right, so one person has biennially, which I'm learning from context means every 2 years, annually, sporadically. That's how I do a lot of things in my personal life, just sporadically. Okay, so we got a few people every couple of years. So they have like a set every 2 years. We're going to review this. Some folks annually. And again, this would obviously include like how often would you like to, or how often do you think that your team should once you've created one? Okay. Wonderful. Thank you. Let me switch the share here. Go back to our PowerPoint. There we go. All right. So with the with the comprehensive workforce plan, jumping back into that, one part is recruitment planning. And we go through all of these steps. And I know it's, especially depending on the size of your screen, that's a lot of really small font on your screen, because we break that recruitment process into really discrete, easy to digest steps. That's to make it really, you know, you can go along. It's the like kind of weird expression of like, you eat an elephant. If you have to eat a whole elephant, you eat it one bite at a time or something. I think it's a strange expression. Don't eat elephants. That seems improper. But if you have to tackle a really large task, break it into small pieces. And that's what we did here. And so in this plan, it goes through that really manageably and really takes you through some of the nuances of each one of these, including things like if you're going to hire a recruiting firm, how to kind of approach that and how to make sure that you're getting your money out of it over time, so that if over time you see that it's not as effective as doing your own recruiting, that you can kind of reassess whether it's worth that money or worth investing it somewhere else. Then obviously we have retention, because we want to keep the staff that we have. And so looking at things like mission, right? Is your health center's mission obvious? And, you know, does it still make sense? Does it need to be updated? And is it really the way that you work? Is it in line with what you're doing, right? Like organization's mission can shift over time, but you want to have that clear mission and kind of explain it to your colleagues and everything, and kind of show why that's important as a guiding light, a guiding principle for your organization, and how it can affect everything that you do. Compensation, obviously people work because they need to be paid money to survive. That's the way it works. And so that's very important. But compensation also includes things like benefits and these other less tangible factors. And so we'll talk some about that, and not just about what should be included in there, but how to make those things really apparent to employees. Because everyone can raise their hands, even though I can't see most of you. You can put in the chat if you want. Have you ever worked at a place where you had no idea what the benefits were? They were never explained to you. No one ever went through them with you, or they went through them like really quickly when you were hired and you never heard about them again. Versus if you ever worked at a place where they routinely had trainings on like say financial literacy, so that you can really make the most of your retirement benefits. You can talk to, if it offers life insurance, you can talk to the insurance provider and kind of talk through those things. They'd invite them in to speak, things like that. They really highlight not just what benefits available, but why is it valuable and how to really take advantage of it. That's something that's really important. We talk about things like work schedule. How do you build out work schedules? Is there flex within them, right? We work for health centers, which provide mostly primary care, but medical care is one of those things where if you restrict it from like 9 to 4, that's really hard to access for some people, because they have to work, and not everyone may have a job that allows them to take significant time off to go get a checkup or whatever. And so, in theory, like we're probably dealing with some schedules that are going to range through a larger part of the day than just those kind of traditional banker's hours. So that gives you the opportunity for more flexible work schedules. That can be something that's really attractive. Someone mentioned like how to draw in people when you may have some challenges like, oh, it's in a pretty remote place, so not every physician may want to practice, or not every, clinical staff member may want to work that far out. But you can attract some people with things like flexible working schedules and everything. Can they work, morning shifts where they start early, end early, or evening shifts where they start late, end late, weekends, things like that. So people can flex around all of those things that happen in our lives. I worked a long time ago in EMS, and I knew a guy who got up every morning at 3 so he could work the shift that started at 4 a.m. so that he could be done in time to go pick up his kids from school. And that boggles my mind. I couldn't wake up at 3 for a job every day, but some people, like, that is really important. That flexibility was really important to that person. And so flexible work scheduling can really be a benefit. And then career paths. Knowing that you are invested in them will really help people, one, want to stay with your organization, right? Like, oh, I can, I know that I can say, hey, I would like to do this kind of job one day. And they will be able to help guide me through that process, right? We want to show people that if they're motivated and able to accomplish what they need to do, there's a path from any position in the health center to any other position in the health center. And that people can cross-skill, reskill to switch jobs, move up, promote if they gain, jobs, and that there's that support for them. And then also, I think kind of that support for moving, beyond. If someone has dreams that are going to have to take them away from your organization, you're going to have a much better working relationship with that person while they're there, and they're going to be more productive if they know you're invested in their future, even if it lies elsewhere. And it may lie elsewhere and then loop back around. I have a friend that I used to work in a health department with, and she is in PA school now, and she will be returning to that health department to work. She started as a lab tech. She's going to PA school, and she's going to come back as a physician assistant for them because she liked working there. She knows that place. And so being invested in people, even if it means moving on, having that conversation of we will support you no matter what, can be really important. And so that's that career path part. All right. And then all of this may seem kind of a little daunting, like where do we start? And so at the Star Center, we've created this workforce self-assessment tool. And this tool is really nice. Like as you go through it, you get immediate feedback on things and you get some initial recommendations. But basically, it's going to walk you through this process. And I've taken this a couple of times now because did some updates to it. And Suzanne just put the link for it in the chat. But basically, it's going to look at, your provider capacity, infrastructure, what's your recruitment and retention planning like, how does leadership operate, how does compensation look there, are there other strategies you're using for retention? And pardon me one moment, forgot. Excuse me, sorry about that. So it'll take you through all these categories and ask you some questions. And as you go through and fill it out, it's going to give you feedback. And at the end, it's going to give you kind of a report out of focus areas that you might want to really start with as far as assessing, like, where are we at for this larger recruitment retention picture? What issues might we want to address first? My slide won't change. There we go. And that assessment is going to be your coursework for this evening, and it's going to provide some of the first data that we're going to produce here that will go into your data-informed comprehensive workforce plan. Right? We talked a little bit earlier about data, and basically it's just information, right, that helps you make a decision. And we want that information to, come from a good source, and we want to make sure that we know the context for it. So we might get it from our staff, feedback from our community, including the clients that we serve. It might come from within our organization or from an assessment from an outside organization. Human resources, you all collect tons of workforce data, right? So that can be really valuable. And if you find that there's gaps, you may do something like employee satisfaction surveys. You may do stay interviews, things like that. We are collecting data. Just no matter what you really need to know is that the data is only as good as how it's collected and how it's used, right? So we need to understand context anytime we're using either qualitative or quantitative data. Both qualitative and quantitative can be really useful. Usually you need both kind of in tandem so that you have that full context so that you're acting correctly on the data, right? Because I can collect quantitative number data by something like, say, a Likert scale. And how much do you like your job, right? Not at all. It's okay. Love it, right? That's my kind of 3-step, really short Likert scale. Well, if I send that out to all the staff and I get back, well, half the staff love their job and half the staff hate it, that information is not really useful to me, right? Like, I just kind of know that we're divided over whether people like their job. I don't have any context. So that's where we gather that qualitative data, right? We have that free response box below, like, why'd you put the answer above? Oh, well, all the people that don't like their job say that the pay is not high enough, and all the people love it say that they love their manager. Okay, so I know stuff that's going well, and I know stuff that needs to be reevaluated, right? So you can see how those two types of data really work together, and how you have to really pay attention to how you're collecting them and everything to make the most use of it. And then we like the saying from Edward Deming that without data, you're just another person with an opinion, right? So we want to make sure that our comprehensive workforce plan is not just an opinion, but that it's supported by really good data. All right, our final piece here is the changing workforce landscape. And I don't know if anyone noticed, but a lot of stuff has happened in the past like 3 years, and things have really changed. And they've always been changing with workforce, right? Like the way in which people work, the industries, everything like that constantly changes. What people want from a job, how they interact with their job environment versus the rest of their life, all of that constantly changes. And so we need to be able to continue adapting. Another reason to have this plan and to write things down, right? We want to keep paying attention to, oh, stuff has changed. So now the way we've been doing things, and we've written it down here, we may need to modify it to adapt to the changing world, right? And not all change is bad, right? Sometimes it makes you adjust. Sometimes it really helps to make the workplace better, right? Social justice can seem like a very slow process, but obviously over the last several years, there has been some really fortunate kind of expansion of people's understanding of the needs for justice, equity, diversity, and inclusivity, and really focusing on principles like that. But also things like, flexibility in working, and the idea that people can work remotely and still be productive. All of these kinds of things have come to light. So sometimes that change really shows opportunities, because those allow us more flexibility and to be more equitable and just in the way that we deliver the services that we do as health centers. So it's all really good, but we need to keep track of those changes. And so those things that I talked about are there. Again, one of my biggest ones is pathway development. So making sure that people know that they can continue to grow professionally, whether they want to stay in their job and just keep getting better at it, or they want to take on more responsibility, or they want to switch to a different type of job. Any of these things, we want to make sure that staff have that opportunity, and that's going to help allow them to stay with us longer rather than having to go afield to search out new opportunities. And then obviously things like compensation equity, really important. We'll talk about that more in another session. Multi-generational staff. I have my own soapbox on that, but generations are pretty artificial labels. One of the biggest things is just if you treat people well, you're treating them well. And ultimately that ends up looking very similar for things. So just create a good workspace, right? And allow people as much flexibility as you can, as much input in how you shape your processes. All right, going along with that changing workforce landscape, you, I'm sure, have heard the term, the Great Resignation. I don't like that term. It's the Great Transition, right? Because if you look at what happened, people really, and you can see, there's a little link in this article, so when you get the slides, you can listen to this. But what this article actually goes into is showing that people didn't just leave their jobs and not go back. Most people change jobs, and they're looking for things that provided safe fulfillment or better pay and benefits, or just a change of scenery because they were burnt out on what they were doing. All of these reasons affected people's decision on where to go and what they wanted to do. So yes, a lot of places lost employees. There's a lot more competition over employees because unemployment is very low. But all of that is still an opportunity. The fact that people were transitioning and still are, gives you a huge opportunity to find the people that are in transition and to be the employer that people are transitioning to rather than the one they're transitioning away from. I know healthcare in particular faces a lot of challenges, but just as some people are leaving jobs to move to a totally different industry, some people are just leaving jobs to move to one where they still have experience, where they'll still get higher pay because of all that experience, where they can still do the things that they love, in the health center case, helping people, but just that treats them better as an employee and that fulfills some of those needs, like say career development or things like that. So you really have a lot of opportunity to take advantage of this. And then also understanding that despite the challenges of the pandemic, we have in many ways become kind of more productive. We found more efficient ways to do things. So in the medical field, something like telehealth services, not always appropriate, but when they are, they can actually allow people to be more productive and can create greater access, again, when they're deployed correctly. So there's all kinds of opportunities. So just to make sure that while there has been a lot of bad news over the past few years, it's not all bad. And if we approach it in the right way, it can be really beneficial for us. Okay, I know that was all a lot. We're all gonna pause for a second. I at least have to take a deep breath because I've been talking nonstop at you for the past 45 minutes. So, and if anyone wants to, you are welcome to unmute and ask a question. You're welcome to type it into the chat. And then if we, since we have a little bit of time left, I wanted to take time to discuss these questions that you see. So we have, what is a strength or success your health center has in their workforce recruitment and retention efforts? So like, what's something that you feel like is going well? What's something that you need in your retention and recruitment efforts, right? Where do you feel like, oh, I thought we were doing well on this, but it just doesn't seem to be working for us? We need to expand this. And that'll go a lot back to that earlier Mentimeter question. But now that we've been through the presentation, I want to know if people had kind of rethought some things, maybe reprioritized. And then finally, if you have anything where you're like, this is something I know that we are doing a great job with, and I want to share it with my colleagues, I wanted to provide an opportunity for that as well. Like I said, let me pull this up so I can see everyone. You're welcome to just unmute and go for it. I think we're a small enough group, but if you'd prefer to raise your hand, I can see the whole room now. And then if you want to just type something into the chat.
This is Danielle Fuller. I think just one strength is that we, I don't want to say we network, but we've developed some good local resources, and we stay in touch with those resources. So, you know, the colleges, the universities, associations, other partners, because with a very tight workforce, you know, everyone's recruiting the same people. So I want to talk more to it, but I don't want to go into a long, but it's just really developing those partnerships and keeping them alive, because they help you in the recruitment side, but they also help you in the retention side because we share best practices.
Excellent. And can I ask, are those partnerships with similar organizations or other community organizations, or is it, say, like working with a, you know, school to do an apprentice program?
A little bit of everything. That's what, you know, we partner with other community health centers. We partner with, quote unquote, our competition in some way. But also with the schools, the North Carolina Apprenticeship, North Carolina Works, the various colleges and universities in the areas, and high schools as well. So.
Fantastic. Yeah, I like the idea of, like you said, in some ways your competition. But I think there can be a lot of opportunities to like share part-time workers or something. I don't know exactly what you all do, but I think that can be an easily overlooked opportunity.
It's interesting you say that. I'm just going to give you, we didn't do it, but we did have discussions. So we have an arboretum that does a Christmas lights kind of display, and their work hours are from 4 to 10 or 4 to 11 for a 2.5 month period. And I was sitting with the individual and I said, how do you recruit? And she said, she goes, believe it or not, 75% are repeat workers, but she faced some challenges this year. And this is me helping, I should say me helping her, but us helping our own staff. And we had staff that ended work at 4 and 5 o'clock. And I said, would you welcome me sharing this part-time opportunity with our staff, because it is the holidays, people need more money, and you know, and my employees keep coming to me, can I get overtime, and you know, this and that. And we actually matched some of our workers up because they were super flexible with their schedule. They weren't strict to 4 to 11. If you know, they had people 6 to 11 and some people 4 to 6, and they had it down to a science, but it was the people. Well, in flux of it, she also said, please send me all of your jobs, because we have a vast volunteer network that likes doing community work. And we did hire 1 or 2 people from that posting. So it was a win-win all the way around.
That's fantastic. Thank you for sharing.
And I hate to say this, I wanted to jump on quick. I do have to drop off because something came up for 3 o'clock, but thank you. I'll look forward to the next session.
No worries. Thanks for being here. All right.
Hi, this is Kelly. I am the HR director at Mosaic Health. We have locations in Western New York State and Central New York State. I had an appointment prior to this meeting, so it ran over. So I'm joining from my phone. I don't necessarily have all the information that was in the chat. So if the link to that document could be sent out afterwards, I greatly appreciate it. I could say that one strength of our health center, of our network, is although we do have a high rate of turnover, there's also a core group of employees that have longevity with us, and we really value them. We value their insight. We value the relationships that they've made with patients and their families, and really rely on them for our integrated care approach. You know, they're not necessarily the providers. They could be, you know, a medical assistant, for instance, but they know our patients, and that is definitely something to celebrate. In regard to a need, I'm really struggling with provider recruitment in the dental arena. So trying to recruit dentists has been really hard. And now I'm running into the same thing with hygienists. We're all over the place. They're not applying. We've tried all sorts of different things. So I want to hear what other people are doing and come up with some new tactics. And one thing that our health center does fantastic and want to pass it on is just as far as our HR team, right from the COO who oversees us right on down, we're responsive. Customer service is important to us. Our employees and our, applicants, those are our customers, and we just really try our best to serve their needs.
Excellent. Yeah, thank you for sharing. And all of the documents that we discussed are linked in the PowerPoint. There will be hyperlinks, and that will go out as a PDF on the discussion board. So you'll have access
Perfect.
to all of those.
Greatly appreciate that.
No problem. All right. And real quick, before we get too many, because there's been lots of activity in the chat, if it's okay, I'll read those real quick, and then we'll go back to anyone that wants to unmute and speak. So we had Sandra noted one of her health center strengths is they have a very comprehensive onboarding process. So that's good. That's really important, that not just orienting employees to where they know like where the bathroom and the copy machine are, but like really onboarding, allowing people to come in and become part of and add to the culture. Yeah, that's terrific. And then values, culture, benefits, and onboarding are their strengths. And that was Malalani. Let's see, Marcy said, we have a good community partnerships to support our mission. Their need is figuring out how to stand against some of the bigger health centers around us and sell the mission over money. We do a good job connecting with the applicants as we onboard them. So that's good. And, obviously everyone's context is different. Sometimes a competitor can become an ally when you talk about opportunities to share part-time staff and things like that. But then obviously you also have to get people who want to come to where you are. So we'll talk more about that later on in future sessions, but there's a lot of things you can do in your job postings to make sure that not just you're getting applicants, but also that they are ones who want to go to your health center and see the benefits of being there, and how to say point out things like, oh, cost of living here is much lower. So yes, the number on your salary might be a little lower, but what you're going to spend to live day to day is going to be so much lower. It'll more than make up. And how do you present that in a job application or a job posting, right? That can be really difficult. So we'll talk about some things like that later on as well. Let's see. And so street medicine program is an absolute strength and success. They go to homeless encampments and treat as many patients as they can. So that was Kevin. And yeah, those are really fantastic programs, and also good opportunities to engage with, say, like training organizations to do partnerships, where sometimes you might be able to take, residents or even med students if you have a training program in the area, or even say like nursing students and everything. I know like in street medicine, it can be sometimes kind of challenging to work out the logistics with that, but there's good opportunities to kind of spread the word about your health center and about the good work it does, and find people who are, again, really looking for that specific mission. Health center needs a strong recruitment strategy for our area. They're in rural Mississippi. Geographic location has truly presented many challenges with recruiting a full-time physician. And that was from Amanda. And so, yeah, there absolutely are people who want to and like working in rural areas, but how many of them are there, and can you attract them? And then also, does it have to be full-time? Can you find a couple of part-time people? And maybe, there are some of those solutions where it's like, do we have to have people full-time, or how can we kind of make that work? Or even find partnerships again, where you can do some sharing of providers and stuff sometimes. But yeah, that can be really challenging. Let's see, strength, mission, and uniqueness. So we provide services to individuals that have intellectual and developmental disabilities. Sandra, and yeah, that's really, really great. And again, mission, and any way you can really show people your mission and describe it in a way that makes people see like, oh yes, this is what I picture myself doing. It's a great opportunity to use your mission as part of your recruitment. And then we have need. So just I guess that's need in terms of workforce. And we need a workforce plan, an actual document plan. Terrific. So we have that for you. And Suzanne put that in the chat earlier. So yay, Jessica, I think we can meet that need. Let's see, Sharonda said we now have a fantastic marketing director. Excellent. Who's working with their HR department. Good. We'll talk about the recruitment team in another session, but really drawing in people who are going to be involved in all aspects of the recruiting process, including someone who, at least in the past, has had, if not actively has, a job that's, the same, that's parallel to what you're recruiting for. So they can help say in the job posting, here's how you describe what the day-to-day actually looks like, right? And that can be really important for conveying the proper parts about the job. On the need, they have retention ideas to keep younger generation of employees. So yeah, how do you retain people, especially if they want to move on and move up? And so obviously offering professional development opportunities and things like that is really important. But then also letting people know that you're invested in them no matter what, right? Because at the very least, if you just say, look, I know that you might end up going, say, back to school to kind of further your career, or your career future is going to lead you away from here and we can't stop that. Having that conversation at least helps prevent that really abrupt quit, right? Where it's like, here's my 2 weeks notice, and by the way, it started a week ago, right? And that's never good for us. So if we talk to people and have those conversations, it can be a little challenging at first, but then they know we're invested, and it's a lot easier to come to your boss or to HR and be like, hey, I'm going to school, like, can I get a recommendation letter? By the way, here's when I'm leaving, so you can start planning now. Or hey, I'm applying to jobs. I just wanted to let you know. So then you have an opportunity to talk to them about, is there any way to keep them there? Or if not, say like, look, we'll support you, but in the meantime, we'll start, having you involved in finding a replacement and stuff. You can really manage that turnover process a lot better if you're supportive and upfront about it. And it can be really challenging. It's a hard conversation. And having a good marketing team, yeah, you got to let people know that the jobs are out there and really draw them in. And there's a technique to it, and it's something we do a lot of support with is going through job postings with people and helping them fine tune them to hopefully get as good a result. So let's see if we have a there we go. We have a comment from Parastu. If you currently have dentists or hygienists on your staff, should reach out to them and follow their connections. In this market, job postings are not enough. I personally reached out to my network, also new graduates from your nearby dental school. Yeah, absolutely. Connect to schools. If you show your face in the school and actually talk to people about, hey, here's opportunities. A lot of people coming out of school have not had much prep on how to actually start a career and find jobs. If you're the one that comes in and talks to them, that can be a big help, a really good use of time. And then also, yeah, talking to your networks. I mean, during COVID, I was kind of managing a group of nurses. And one of the things that I asked them is just like, we were trying to hire more. I was like, where do you guys go to find jobs? Because I know that I go to Indeed, but is that necessarily always the case? And they would share jobs with each other on Facebook and everything. So you can tap in to those networks, whether they're informal or just finding like what sites people that you've already hired happen to be looking at. That can be really beneficial as far as targeting your job announcements and everything. Finding a way to ensure, measure, and evaluate the employee environment with our clinical staff is safe, welcoming, and of the quality that we expect. Yeah, so trying to get that work environment to be one in which people want to work can be really challenging. One of the biggest things is just like, say that you want to make the place a better place to work, ask people how you can, and then actually follow through on it. Kind of that process, really showing people that you mean it. But it can be challenging, especially if you have, maybe a challenging client population or something. Kind of working with people and saying, what can we do to make this environment better? A strength from Neelam. We offer a good amount of continuing education and training opportunities for staff. Oh, tuition, that's a big one. Seminar and certification reimbursements, excellent. A lot of our staff have utilized these programs to further their career development while being employed. need, we would like to decrease the use of recruitment agencies for our provider recruitment. Excellent, yeah. And reducing the use of recruiting agencies can be something that I think is pretty accomplishable for a lot of people. A lot of it is, you know, obviously talk to your staff, get feedback on where they found jobs, especially ones you've recently hired, or anyone that knows friends who are looking. Hey, where do they look? What job boards do they go to? What social media do they use? And then also going on those and looking at jobs and thinking, if I were applying for a job, which one would I go look for? Because I know for me, it's definitely not the one that doesn't list a salary and I have to go and retype my resume into a million little boxes on their own site, right? So you can start to kind of think like, oh, what stands out as good? What stands out as bad? How do you get your initial in at a school? My recommendation would just be reach out, right? A lot of instructors, so like go to the school's website, find the program, and usually you can find the address for a program manager or even a professor there, and or an instructor, and just reach out to them by email. And usually they're going to be really happy to have someone from the real world come into their classroom, right? Like any good instructor wants that real world experience for their students and is going to be really happy to have someone come talk to their students, even if it's just for a little bit of time, like half an hour on, you know, how do you get a job? What does a job look like? What are health centers, right? So people will usually be pretty excited, even if you have to do a cold reach out. Otherwise, you could talk if you have anyone who's new in their career field, like just came from a school, right? You can maybe talk to them about, hey, did you have any classes where, like, you know, you think the instructor would want to have someone come in, and maybe you can both go in and talk, right? They could talk to their to students from a program they're an alumni from. So there's lots of options with that. But yeah, even the cold calling, cold reach out, I guess, email would be, I think, a perfectly reasonable way to go about it. And then finally, let's see, Sina says, we just hired a hygienist, and during the reference check, one of the references was also a hygienist. She had to is open to entertaining a new hygienist opportunity, and she was, so working on scheduling a proper phone screening. So you got 2 hygienists for the price of 1. Excellent. Yeah, so I mean, on reference checks, like, hey, is there anyone else you would recommend for this position as well? Like if you're looking for that, right? If you trust that reference for one person, why not have them pass on that information to anyone else who's looking for a job? I think that's a really, really interesting, creative way of doing that. And we still have, we have about 5 minutes left. So everyone, I'm going to go through the rest of the slides real quick because there's a few more and I want them to be on the recording and everything for everyone. If in the meantime you want to raise your hand or anything, I'm more than happy to keep the conversation going. I'll stick around all afternoon. I don't care. But I know you all have lots of work to get back to. So I'll go through the rest of the slides. If anyone else wants to jump on and say anything, more than happy to keep sharing. And otherwise, thank you so much for joining us. This was really fantastic. This is going to be a great recruitment boot camp. All right, so coursework and next steps, right? We talked about the workforce self-assessment. Here's the link to it again on here, and Suzanne had put it in the chat earlier. I mean, you can always go on the PDF of the slides and click it here, and we would just like you to complete that before the next session in 2 weeks. I think it'll give a lot of insight and hopefully give us more to talk about next time. All right, logging into the discussion boards. So you can go to, there will be a link in this, but obviously to get access to that, you'll have to be able to log into the discussion boards in the first place. So let me pull up the link and I will put it in the chat one more time. Sorry about that. The Zoom window is staying over top of what I want. Oh, or it looks like, nope, Mariah beat me to it. I should have known. Thank you, Mariah. So she put that in the chat. So that's how you get to our discussion board page. And all you do is put in your login information if you need to create one. Okay, yeah, Mariah said you should have received information on how to log in earlier today. So check your email. If you have any issues, email either me or Mariah, and we will get you all set up. Basically just putting your username and password. We all know that drill. Oh, and when you log into the discussion board, you can see the little green arrow there. You'll have something. You shouldn't have this many discussion boards on your thing. So don't worry about that. You should probably only have this one, or if you've been part of a past learning collaborative, you may have a couple, but just look for Recruitment Boot Camp. This one should be 5.0. But if you have a Recruitment Boot Camp link, that should take you there. The discussion board breaks down each of the sessions, and there's a resources tab and a discussion tab. So just check under both of those. We'll post resources under resources, and then you can talk with each other in the discussion tab and, you know, continue the conversation, share any tips and everything. It seems like everyone has a lot of different experiences and a lot of different ideas and everything. So I think this is going to be a really, really good group. All right. So thank you, everyone. Just in case you need the schedule for our upcoming sessions, but every 2 weeks, same bat time, same bat channel. And then here's a resources page. You can go to chcworkforce.org, our website, and search any of these things, and they'll come up. And we have lots of great resources, and we'll point them out more and kind of discuss different ones as we go through different sessions as well. We'll discuss ones that are more applicable. We also have some self-paced courses, so we encourage you to look at our e-learning courses on there. It's easy to register and get a login. And then we also have a podcast series that all of us have worked on, but my colleague Helen has done a ton of great interviews with that. So I really would encourage you to check out this most recent and our past seasons of the CHC, of the Star Center Talks Workforce Success podcast. We have some really good interviews on things like resiliency and ways people are kind of adapting to the new working environment. They're, you know, about 20 minutes a piece, so they're nice, easily digestible episodes. Okay, and if you have any questions, please feel free to reach out to any of us. Thank you again, everyone, for joining, and I hope you have a great couple weeks. We'll see you again soon.